Hi everyone, my name is Lauren Ruger and I'll be presenting today on ultrasound-guided histotripsy ablation in feline patients with injection site sarcomas. Feline soft tissue sarcoma and injection site sarcoma are rapidly growing tumors with low metastatic potential but locally aggressive behavior. Currently, aggressive surgery and radiotherapy are used to treat feline injection site sarcoma, but tumor recurrence remains high because adequate surgical margins are often impossible to achieve. The graphic on the right highlights the recommended feline injection sites. The body region shown in green can be more easily removed in the case of feline injection site sarcoma development. Overall, less invasive and more effective therapies are needed to treat feline soft tissue sarcoma and injection site sarcoma, particularly for patients who are not good surgical candidates. Histotripsy is a non-thermal, non-invasive, focused ultrasound method that uses high-amplitude ultrasound pulses to generate acoustic cavitation. The histotripsy cavitation bubble cloud is only millimeters in size, offering high-precision ablation of soft tissues and tumors, which can be visualized on real-time ultrasound imaging as seen in the video. In addition to its ablative potential, recent studies also suggest that histotripsy can stimulate an anti-tumor immune response. Recently, our team completed a study demonstrating histotripsy's safety and feasibility as an ablative and potentially immune-stimulating therapy for canine soft tissue sarcoma. In this study, 10 dogs with spontaneous soft tissue sarcomas received single histotripsy ablations of portions of their tumors. All patients tolerated the histotripsy treatment well, and results identified a removal of viable tumor cells in the targeted regions, as well as early evidence of local and systemic immunological changes following histotripsy. These results are promising, but to date, histotripsy has never been investigated for feline cancers, including feline soft tissue sarcoma or injection site sarcoma. This first-in-cat pilot study investigates the in vivo safety and feasibility of histotripsy to treat feline soft tissue sarcoma and injection site sarcoma. Patients were enrolled based on predefined enrollment criteria and received pre-treatment CT scans to characterize their tumor and to identify the optimal region for histotripsy. On the day of treatment, patients were anesthetized and the hair overlying the tumor was removed. After coupling the transducer to the tumor using a bowl of degassed water, custom software was used to define elliptical treatment margins before commencing the automated image-guided histotripsy treatment. 3 to 6 days after histotripsy, patient tumors were surgically resected and sectioned for subsequent gross, histological, and immunohistochemical analyses. We hypothesized that histotripsy could be used to safely target and ablate feline injection site sarcoma tumors while promoting immunological changes to the local tumor microenvironment. The histotripsy system used in the study is shown here. A 1 megahertz histotripsy transducer with a coaxially aligned imaging probe was used to treat patient tumors. Single-cycle histotripsy pulses were applied at a pulse repetition frequency of 500 hertz and a treatment dosage of 500 pulses per point. 3 cats were enrolled in this study with grade 1 to 3 soft tissue sarcoma tumors with subtypes of fibrosarcoma and myxosarcoma. All 3 tumors treated were consistent with past injection sites and suspected to be injection site sarcomas. CT, optical, and ultrasound imaging of the patient tumors are shown on the left. All patient tumors were greater than 2 centimeters in the longest dimension and clearly visualized on the staging CT images. Precise cavitation bubble clouds were generated in all 3 patients at estimated treatment pressures averaging about 29.5 megapascals. Treatment targets were very shallow, and varying degrees of prefocal cavitation were also observed on ultrasound imaging during treatment. The occurrence of this prefocal cavitation correlated with varying degrees of gross ulceration identified on the skin surface following treatment, but did not impact patient outcome. In all patients, histology revealed ablative damage in the form of necrosis and hemorrhage in targeted tumor regions. Viable tumor cells remained in sections of the treated tissue, suggesting that a higher histotripsy treatment dose may be required for this application. Example histological images from all 3 patients can be seen on the slide. Immunohistochemistry staining was used to identify changes to the immune cell population within the tumor following histotripsy ablation. Tumor-associated macrophages were stained with IBA1 and increased in number in the treated regions for 2 of the 3 feline patients. IHC images from one of the patients are shown here. Dark purple staining indicates a cell positive for IBA1, with notably more positive cells in the treated tissue. Tumor-infiltrating lymphocytes were investigated using CD3 and CD79 stains. No significant changes in tumor-infiltrating lymphocyte populations were observed for either protein. In conclusion, the results of this work demonstrate that histotripsy is able to safely target and ablate feline soft tissue sarcoma and injection site sarcoma with partial tumor ablation achieved in all subjects. Because regions of intact cells remain in treated volumes following histotripsy, optimized treatment doses must be determined before the clinical translation of histotripsy for feline injection site sarcoma will be possible. Immunohistochemical results suggest immunological changes to the tumor microenvironment, showing an increase in the macrophage population in treated tissues. To investigate the systemic immunological effects following histotripsy, cytokine concentrations in pre- and post-treatment blood samples are currently being quantified and compared. Overall, future studies investigating histotripsy for the complete ablation of feline injection site sarcoma and soft tissue sarcoma are warranted. I'd like to thank the members of the Vysoplovich Lab for their help and support, as well as Drs. Klein and Yang at the Animal Cancer Care and Research Center for their partnership on this project. I'd also like to thank our funding sources listed at the bottom of this slide, particularly the Focus Ultrasound Foundation, for financially supporting this project. Thank you.